Acute bronchitis is a type of respiratory infection that affects the bronchi, which are the large airways that connect the windpipe to the lungs. The bronchi have a thin layer of mucus and tiny hairs called cilia that help trap and remove dust, germs, and other particles from the air. When the bronchi become infected, they swell and produce more mucus, making it harder for the air to flow through them. This causes a persistent cough that brings up mucus along with other symptoms such as chest discomfort, wheezing, fever, and shortness of breath. Acute bronchitis is usually caused by a virus such as the common cold or the flu and lasts for a few days to a few weeks, depending on the severity of the infection and your overall health. Most people recover from acute bronchitis without any complications, but some people may develop more serious conditions, such as pneumonia or chronic bronchitis, if the infection is not treated properly. What causes acute bronchitis? The most common cause of acute bronchitis is a viral infection, such as the common cold or the flu. These viruses can spread from person to person through the air when someone coughs or sneezes, or through direct contact with infected surfaces or objects, such as door handles, keyboards, or phones. When you breathe in these viruses, they can attach to the cells that line your bronchi and cause inflammation and irritation. This triggers your immune system to fight the infection, which results in more mucus production and coughing. Other causes of acute bronchitis include bacterial infections such as streptococcus or mycoplasma, which can also infect the bronchi and cause similar symptoms. However, bacterial infections are less common than viral infections and usually occur after a viral infection has weakened your immune system. Another cause of acute bronchitis is exposure to irritants such as cigarette smoke, air pollution, dust, or chemicals that can damage the bronchial lining and make it more prone to infection. People who have chronic lung diseases such as asthma or chronic obstructive pulmonary disease are more likely to develop acute bronchitis because their bronchi are already inflamed and sensitive to triggers. What are the symptoms of acute bronchitis? The main symptom of acute bronchitis is a persistent cough that may produce clear, white, yellow, or green mucus. The color and amount of the mucus can vary depending on the cause and stage of the infection. The cough may be dry or productive, meaning that it brings up mucus or phlegm. The cough may also be accompanied by other symptoms, such as chest tightness or pain, which may worsen with coughing or breathing, wheezing or whistling sound when breathing, which indicates that the airways are narrowed or obstructed, low-grade fever or chills, which indicate that your body is fighting the infection, sore throat or hoarseness, which may result from the irritation of the throat by the cough or the mucus, headache or body aches, which may result from the inflammation or the fever, fatigue or weakness, which may result from the lack of oxygen or the energy spent on fighting the infection, loss of appetite or nausea, which may result from the mucus or the medication. The symptoms of acute bronchitis may vary from person to person and may worsen at night or with physical activity. Some people may also experience complications such as bronchospasm, which is a sudden and severe constriction of the bronchi that makes breathing difficult and may cause chest pain, anxiety, or panic. Another complication is pneumonia, which is a serious infection of the lungs that causes fever, chills, shortness of breath, chest pain, and coughing up blood or rust-colored mucus. Pneumonia can be life-threatening and requires immediate medical attention. How is acute bronchitis diagnosed? To diagnose acute bronchitis, your doctor will ask you about your medical history, your symptoms, and your exposure to any potential triggers, such as smoking, allergies, or environmental factors. Your doctor will also examine your chest and listen to your lungs with a stethoscope to check for any abnormal sounds or signs of infection, such as crackles, wheezes, or rhonchi. In some cases, your doctor may order additional tests, such as a chest X-ray, which is a picture of your lungs and chest that can show if you have pneumonia or other lung problems, such as emphysema or lung cancer, a sputum culture, which is a test that analyzes the mucus that you cough up to identify the type of bacteria or virus causing the infection and to determine the best antibiotic to treat it, a blood test, which can check for signs of inflammation or infection, such as an elevated white blood cell count or an increased level of C-reactive protein. A pulmonary function test, which is a test that measures how well your lungs are working by assessing how much air you can inhale and exhale and how fast you can do it. These tests can help your doctor determine the best course of treatment for your condition and monitor your recovery. How is acute bronchitis treated? The treatment of acute bronchitis depends on the cause and the severity of your symptoms. In most cases, acute bronchitis is self-limiting and will resolve on its own within a few weeks. However, you can take some steps to relieve your symptoms and prevent complications, such as resting and drinking plenty of fluids, such as water, juice, or broth, to stay hydrated and thin the mucus, making it easier to cough up and clear your lungs. Taking over-the-counter pain relievers, such as acetaminophen or ibuprofen, to reduce fever and inflammation. However, you should avoid aspirin, which can increase the risk of bleeding, especially in children and teenagers. Taking over-the-counter cough suppressants, such as dextromethorphan, to ease coughing and sleep better. However, you should avoid cough suppressants if you have a productive cough, as they can interfere with the clearance of the mucus and increase the risk of infection. Taking over-the-counter expectorants, such as guaifenesin, to loosen the mucus and make it easier to cough up. However, you should drink plenty of fluids when taking expectorants, as they can cause dehydration. Using a humidifier or a steam inhaler to moisten the air and soothe your throat and lungs. However, you should clean the device regularly to prevent the growth of bacteria or mold. Gargling with salt water or using throat lozenges to relieve sore throat and reduce coughing. Avoiding smoking and secondhand smoke, which can worsen your symptoms and delay your healing. If you are a smoker, you should quit or cut down on your smoking, as smoking can damage your lungs and increase your risk of infections and chronic lung diseases. Avoiding exposure to other irritants, such as dust, pollen, or chemicals, that can trigger or aggravate your condition. You should wear a mask or avoid going outdoors when the air quality is poor or the pollen count is high. If your acute bronchitis is caused by a bacterial infection, your doctor may prescribe antibiotics to kill the bacteria and prevent further complications. However, antibiotics are not effective against viral infections and may cause side effects, such as nausea, diarrhea, or allergic reactions. Therefore, you should only take antibiotics as directed by your doctor and complete the full course of treatment. You should also inform your doctor if you are allergic to any antibiotics or if you have any other medical conditions or medications that may interact with the antibiotics. If your acute bronchitis is caused by an underlying chronic lung disease, such as asthma or chronic obstructive pulmonary disease, your doctor may prescribe bronchodilators, which are medications that relax the muscles around your airways and make breathing easier. You may also need to use an inhaler or a nebulizer to deliver the medication directly to your lungs. In addition, your doctor may recommend corticosteroids, which are anti-inflammatory drugs that reduce the swelling and mucus production in your airways. You may take these medications orally or by injection, or use an inhaler or a nebulizer to deliver them to your lungs. These medications can help control your symptoms and prevent exacerbations, which are episodes of worsening symptoms that may require hospitalization. However, these medications may also cause side effects, such as weight gain, high blood pressure, osteoporosis, or diabetes. Therefore, you should follow your doctor's advice and monitor your condition regularly. In some cases, your doctor may refer you to a specialist, such as a pulmonologist, who is a doctor who specializes in lung diseases, or an allergist, who is a doctor who specializes in allergies and immune system disorders. These doctors can perform more tests and provide more specific treatments for your condition, such as immunotherapy, which is a treatment that involves exposing you to small amounts of the allergens that trigger your symptoms in order to desensitize your immune system and reduce your reactions. Acute bronchitis is a common and usually mild condition that can affect anyone at any age. However, it can also cause discomfort and complications, especially for people with chronic lung diseases or weakened immune systems. Therefore, it is important to recognize the symptoms, seek medical attention if needed, and follow the appropriate treatment and prevention measures to ensure a speedy and complete recovery. Thank you for watching.